Hello everyone, I'm Dr. Darsha.
And I'm Dr. Altamash Raja.
And welcome to Medicine Redefined,
a podcast where we will explore the often overlooked but necessary components of health, what we consider to be the fundamentals.
We will investigate topics and practices that can give you and your patients the best chance to optimize a healthy lifestyle. It's time to move the needle forward and put the health back in healthcare.
Welcome back to another episode of Medicine Redefined. Today we have two awesome guests for you. The first one is Dr. Michelle Seguin. Dr. Seguin is a board-certified family medicine physician, educator, gardener, and an advocate for a lifestyle-driven approach to health that focuses on supporting the individual, family, and community. In fact, much of her advocacy and teaching are centered on the premise that food is medicine. She completed her residency at the Marquette Family Medicine Residency Program after obtaining her doctorate at Michigan State University. She currently holds faculty appointments in the Department of Family Medicine at Michigan State University College of Human Medicine, as well as the Medical College of Georgia at Augusta University. Throughout her career, she has been the recipient of numerous awards, many of which include excellence in teaching and exceptional leadership. Her counterpart, Dr. Danielle Shelton, is also a board-certified family medicine physician and co-founder of CleanYourPlateRx. After graduating from residency, she quickly became disenchanted with the way medicine was practiced, and so in 2017, she created a nonprofit out of desperation for someone to address preventative care in a way that was accessible, engaging, thought-provoking, and innovative. For her medical training, Danielle attended the American University of the Caribbean and went on to complete her residency at Self Regional Medical Center in South Carolina. Together, they've created a network for modern healthcare professionals committed to learning, growing, and connecting together to improve our healthcare system. So in this episode, we discuss a lot about that initiative. We also discuss their journeys and the inspiration for changing the current model of primary care, as well as what gave teeth to the food is medicine movement in their lives and communities. We talk about the intersection between food systems and health systems. We also discuss how to keep social determinants of health at the forefront of our mind during patient visits. We then shift gears to talking about the future of medicine and improving upon the current medical education paradigm. What I loved about this episode is that we got to touch on some of the health policy change that is necessary. Often on this show, we discuss the nuance and the change that can happen at the individual level, but Michelle and Danielle routinely do a phenomenal job channeling their energy into changing systems. I left pretty inspired for a couple of reasons, but one of them is because they're doing the real hard work. As you know, and you'll hear, it's quite rare that doctors don't believe in the message of healthy eating and movement, etc., but it feels like an uphill battle and often not worth the fight. Our guest today highlights several ways by which that might not be the case. So without further ado, please enjoy our discussion with Dr. Shelton and Dr. Seguin.
All right, everyone, welcome back to another episode of Medicine Redefined. This is our first time that we're going to have a dynamic duo sit in with us and talk about lifestyle medicine and a lot of the cool things that they are up to. So we have Doctors Danielle Shelton and Michelle Seguin. Did I say that right? Got it. Awesome. So, we're going to talk a lot about the two electives that you guys teach, at a medical college. We're going to talk about entrepreneurship, the things that you guys have both created, and your partnership. So before we get started and delve into those things, why don't each of you kind of introduce your journey and kind of where you started and that process, and then where you guys are now?
Hey, thank you so much for having us on. It's really a pleasure to be here tonight. And I'll just kind of share a little bit about my journey into medicine. So I'm originally from Upper Michigan, so a pretty small kind of rural community. I'm a first generation college student, so really didn't have anyone in medicine that kind of could mentor me or, kind of help me along this path. And I really just was always very interested in science and in service and helping others, and just kind of gravitated towards medicine and healthcare. And I attended Michigan State's College of Human Medicine for medical school, and I was involved in the rural physician program. So at MSU, they have a specific rural tract for people that are interested in practicing in rural communities, particularly those interested in primary care. And so, while in training and in medical school, I kind of liked everything, and again, gravitated towards family medicine. Really enjoyed the concept of being able to take care of individuals and families and a community, and wanted to return home to my community in Upper Michigan to practice. And so after medical school, I stayed in Upper Michigan to complete my family medicine residency at a community-based residency program. It was an unopposed program, and our hospital was like the primary referral center for the entire Upper Peninsula, so about 200,000 people, which really made it a great training location, particularly if you're interested in, rural medicine. We had a broad scope. It wasn't call which resident, it was call the resident, because you were the only one on. And so it was really a wonderful opportunity. Became very close with my colleagues and our faculty. And after residency, I joined a federally qualified health center at a small community in Upper Michigan, where I went to college and met my husband, and started building a practice very quickly. In our community, there were limited doctors. It's an underserved area, and so I just quickly became, really immersed in medicine, but also just a lot of the limitations of primary care. I just saw so much chronic disease among my patients, and I felt like I had limited tools to really help them lead healthy lives. Seeing a patient every 10 to 15 minutes, filling prescriptions, renewing, lab orders. And I really didn't have the time or the tools really to help people make lifestyle changes. I wanted to help, reverse their chronic conditions, wanted to help prevent chronic disease. And so, I started looking for additional opportunities to learn about lifestyle medicine, learn about food as medicine and nutrition. But also, I think it was important that I learned a lot about the social determinants of health working in this community and through the stories and the lives of my patients. It wasn't just that I felt like I wasn't equipped to help them make those healthy changes, but I felt like there were so many barriers to people making healthy changes. They were having to make choices between paying their heating bill in the winter and buying healthy food or getting a prescription filled. And so, really thinking about the social determinants of health became a passion of mine as well. And so, shortly into attending life, I started looking for, lifestyle medicine conferences and food as medicine conferences, culinary medicine. And I came across a conference called Farms, Food, and Health. And it was really a powerful experience for me because I got to see the intersection between food systems and health systems. I was introduced to innovative programs like produce prescription programs, which helped kind of bridge food and health, help to address food access and food insecurity by giving patients vouchers to purchase healthy food at farmers markets. And so I brought that back to my practice and was able to implement a produce prescription program pilot with 30 patients in my practice. I was able to get some grant funding. And along the way, I met Danielle, and we connected through social media, and we can talk more about that, but we met online like a lot of millennials do on Instagram, partly because I was just really searching for other doctors that were doing this kind of work. I felt isolated where I was, and I really was looking for community. And so I guess I'll stop there and kind of throw it over to Danielle and let her share a bit about her journey as well.
Yeah, so I had kind of a unusual journey into medicine too. I always wanted to do it when I was a kid, and I thought, I loved like the Discovery Channel and National Geographic, and just always found, the human body really interesting. And then I was like, it takes how long to be a doctor? Yeah, I think I'll pass. So going through college, I took pre-med prerequisites, and, kind of still thought about it. My parents my dad's Japanese, so he was always like, do something in the STEM, like that's it. I will not pay for college if you're doing something else. So I just kind of always loaded up on those, but I did acting classes, a lot of drama. I was a psych major, so it's kind of a little, a little all over the place as far as that was concerned. And then kind of last minute in college, I decided that I did want to go to medical school. And I ended up actually going to a Caribbean medical school. I went to AUC, and I loved it. Actually, I completely loved it. I spent my third year in England learning medicine in a whole different kind of world and realm. And it was very different because I was taught by attendings. Like we had like one-on-one, their residency programs are very different in how they kind of train their doctors. Medical school starts right out of high school, essentially. So, and then they become registrars after you graduate, and that takes forever, and you only become an attending if there's like an open spot. So I worked lots with one-on-one with attendings. They had a great passion for teaching. They're not rushed. Clinics would take like 4 hours, and people just kind of did it. It was like it's totally not American medicine. But I got to learn a lot, and it was really cool. And then kind of after that, went to residency in a small unopposed program in Greenwood, South Carolina. Same experience as Michelle. Lots of inpatient medicine, not so much outpatient medicine, which I think is a lot of family medicine programs these days, even though most of us do end up going into heavily outpatient. And then I moved to southern Georgia, like right next to the Florida-Georgia line, another rural town. And that's kind of when everything changed. Because, you have this like moment after residency where you take like this deep breath and you're like, oh my gosh, I can sleep, I can exercise, I can eat like real food again. What are hobbies? So it was just this moment where it's like, okay, like what does the rest of my life look like now that, my eyes are, wide awake. And I realized that modern medicine was just like this big disappointment. You spend so much time learning and being focused on, that you don't realize that it's very consumer driven, right? Medicine is very like, see this amount of people in this amount of time, order this amount of tests, and meet your quota. And it's like, nobody cares about anything else besides that in corporate medicine. And it was just like, people came in with their first heart attack, newly diagnosed, diabetes, hypertension. And it's like the pillars of all that change is lifestyle medicine, right? Lifestyle changes. You're supposed to tell them what to do. And it's like, we didn't learn any of that. They're like, how many cups of vegetables? Like, well, heck if I know. What kind of exercise is the best? Like, I don't know. And I saw that my colleagues were just watching Dr. Oz or Oprah or the myriad of different health experts out there, in quotation marks, and giving them that kind of advice, right? Which was not really helpful, because how many people have done diets or done all these things and then you just fail and you give up and it's unsustainable. So my father he's retired now, but he was a restaurateur in New York. So I always had this idea that like good food tastes good, and nobody wants to eat steamed broccoli for the rest of their life. That's just like a depressing idea, depressing everything. And food is, for me, it was always, my culture, it was always family, it was always community, it was experience, right? And if you kind of deduce that to just, macros and micros and how many grams of fat and what the salt content of this is, then it takes all the joy out of that experience. And that's like not fair to do to ourselves. It's really not fair to do to our patients. So that's kind of when I delved into culinary medicine, and I started a nonprofit about a year or two after I graduated, because I looked for places to send people, and like that didn't exist, right? There's like no really great culinary programs that you can send your patients to outside of Tulane, or Harvard has some too, but that doesn't really exist in small towns, doesn't really exist in most of America. So that was kind of the genesis of that. And then I was looking for other doctors, and Michelle touched on that, and she messaged me on, on Instagram, and I was like, oh, you know what you're doing? Like, let's talk. And she had run a successful prescription vegetable program, and that was kind of the genesis of our friendship, was that.
No, I love that, right? So quite diverse backgrounds, but it's interesting how our paths converge, right? I mean, you guys share your story about how you met, and it's actually reminds me very similar to how we both started this project and really our relationship. And, both of you guys has some really great stuff. And I'm going to come back to this concept of social determinants of health, explain a little bit more and how it affects our practice and really your practice today, Michelle. But you also both touched on this concept of the business of medicine drives the practice of medicine, right? And this is something that we've talked about time and time again. And I think a lot of the folks that we talked to who've been on here as guests before, they've had that struggle, right? They've had that insight at some point and they've changed course. So I'm curious, if I could start with you, Michelle, is what's your practice like today, right? Are you still, seeing patients every 20, 30 minutes? Like, is it primarily more like a cash base? Like, if you could define that a little bit, and then Danielle, right afterwards, I'd be interested in yours as well.
Yeah, thank you. That's a great question. And my course changed after 5 years in primary care. And so, as I mentioned, I was in a federally qualified health center, running through patients very quickly. And, the Produce Prescription Program really opened my eyes to the work that can be done outside the four walls of our clinic. And as part of this program, not only did the patients get vouchers to, purchase the food, but we incorporated education and recipes that changed every week. And I worked with our local university to do a small study with this because I thought, like everything in medicine, if we're going to see if this really has an impact, we should measure outcomes, especially if we're looking to hopefully have programs like this covered by insurance and other payers in the future. And so with the study, we looked at changes after 10 weeks in some biometric data. So looked at weight, BMI, blood pressure, fasting blood sugar. But I also did, more like subjective, we did objective survey work, but, we were looking at changes pre and post in dietary habits, looking at changes in quality of life. And what we found was that in 10 weeks, there was a significant quality of life improvement. And that really was like a light bulb moment for me. It's like, if we can connect people with these resources, if we can connect them with where their food comes from, we have the opportunity to change people's lives. And that was when I realized I wanted to make a change. And so after 5 years, I left my primary care practice and I joined our local health foundation, which initially funded this pilot program in our community, to take on a new position as the director of community health, where much of my focus for the last 3.5 years has been at the social determinants level in my community, looking at how can we connect food systems and health systems. And so now my day-to-day colleagues are city planners and dietitians and farmers and teachers and city councilmen. It's been a really interesting journey, something I never really expected when I went into medicine. I really wanted, to kind of stay as a rural family doctor. I figured I'd be there for 30 years. And now I see that, my scope has changed. And, in the last 3.5 years, we're doing some really amazing things, looking at, particularly with food, building community garden infrastructure to give people the opportunity to grow their own food, expanding farm to school programming in our school system so that we can not only incorporate nutrition and gardening education in the classrooms, but now we're getting to procure local food that's going into our cafeterias. So we're changing the food environment and the learning environments in our schools. And so I guess those are just a few examples, but my path definitely changed as a result of that experience early in my career.
Yeah, and I'm still doing corporate medicine. I'm working on a bunch of other things, but I think that what really got me was the burnout statistics that I read while looking into lifestyle medicine pretty early. It was like 300 to 400 doctors commit suicide every year. We have the highest rate of burnout of any profession, and that's controlling for income and education level. So that was like, it was like a moment for me. It was like, what can I do to prevent myself from burning out? And I think, one of the things that I discovered was advocacy, and I think, speaking for others and myself, on a bigger and more national scale has really helped. I've put together some physician conferences because I have this passion for other physicians, and the idea is just that, there's a lot lacking in cross communication, cross collaboration, right? We're all kind of in our silos, doing our thing, and there's so much to be gained from just talking, and I think Michelle, in our relationship, was the thing that I realized. It was like, oh my gosh, if we just chatted and shared resources and were able to, just kind of come together, their medicine would be so different. And that was kind of where Rethink came from, and Clean Your Plate. And it's just this idea that, corporate medicine doesn't always have to look like this. And there's things that we can do, to change that. And that's like the driving force for my practice every day, is that, this is the status quo right now, but it doesn't always have to be. And that the future of medicine is bright with people like yourselves and, Michelle and I kind of pushing that forward.
Yeah, I think, hearing both of you talk about your experiences and kind of how you are trying to implement change and the vision, it reminds me of just how the doctor is that middle person, right? Like, we're trying to bridge the gap between the consumers, the patients, with the government, with the systems, right? And so you kind of need this top-bottom approach, right, Michelle, which is what you're talking about, talking to city councilmen, talking to actual city planners and the government, and trying to enforce change, right, from the top bottom. But then at the same time, we know that public trust in the government's like at an all-time low, right? So how do we as doctors also implement lifestyle intervention to the patients in order to already get them started, or a little bit of a head start, so that now when you have change on both ends, we're really that, person in the middle. And sometimes there's a sentiment out there that, oh, it's not the doctor's responsibility to really focus on lifestyle. That's what the dietitians are for, the nutritionists, the physical therapists, and we're really there just for the acute changes, right? That happen almost like in the ER. But how do you guys think about this issue, right? Like, is there a step-by-step approach that you guys have? And I guess we're getting a little bit into the entrepreneurship of it, but do you guys have like a systematic plan in hand, or is it kind of like, hey, wherever I can make these changes, I'm going to take?
Yeah, so I'll speak for myself, and I'm excited to see how Danielle will answer this. I think for me, it really it's very personalized, and I think it depends really on the individual, physician, as well as, their community that they live in. And so I think, one thing that we talk to our students about in the electives at the Medical College of Georgia is that, as a physician in this role, we have the opportunity to make change at any one of those levels. And it doesn't have to be all of them at the same time. And that, there is a lot of power that comes with this position, and that we have the opportunity, to share our voice and our expertise, in the exam room with our patients, but also out in our communities. And so I would say, it really it's individualized. But I'll throw it over to Danielle and see what she says.
So I agree. And I also think, to go to your question, I think medicine is too siloed. Like, I think there's a role for knowing where your expertise kind of ends, right? And asking for help. I think there could be a lot more humility in medicine, in physicians, and pretty much everyone. And saying, hey, let's punt it to the dietitian at this point, or let's consult whoever. but there's such good research out there that, when doctors know lifestyle medicine interventions and how to actually apply them, and when we ourselves are healthy, that makes our patients healthier. So if we are actually living by these rules and know, how many cups of vegetables to eat, how to cook healthy meals, it makes it so much easier to give that advice to other people, right? Because if you're not just talking about something theoretical anymore, you're talking about, hey, when I'm really busy, I've worked 90-hour weeks, this is how I get in some vegetables, this is the exercise routines that I do. It becomes less cerebral and becomes more practical. And I think a lot of medicine is academic. And I've been to conferences where it's all academic, right? All lifestyle medicine is like super academic. And it's like you buy all this stuff, you talk way up here, and it's like, that's great, and I think we need that. And that drives research. But it doesn't do much for the doctor in those rural communities, those physicians who are not in those large academic centers. It's like, no, you really need to figure out what the practical approach is to this, and how they can implement it in their clinic on a day-to-day basis when they're rushed, when they're resource limited, right? When their patients have low resources, like what does this actually look like? And then I think, the communication is so key. Like that's the one thing I learned, that my biggest advocates for lifestyle medicine and my patients in my community were not other physicians. It was the dietitian, it was the diabetic educator, it was the physical therapist, it was nurses, it was all these other factions of medicine that I had never really spent much time in, right? Like in residency, dietitians order TPN. That's literally what I knew about them. And they were just such big advocates, and they got programs that I wanted done, they pushed them through because they just knew how to do it. So I think that in medicine, if we want to make change, we've got to link arms with the people around us, and have humility and say, hey, I don't know that, or I want to learn that, or what's the answer to that. And it's, you don't know everything. Nobody knows everything. And there's no shame in that. I think a lot of times we want to know everything because, you get pimped by attendings, and it's like, they'll pimp you until you don't know. And then it's like they make, and then it's a big deal and you feel embarrassed. And it's like, no, like life is full of questions. And the biggest thing you can do is just keep asking them, and keep learning. We're all nerds, in our core, we're all nerdy. So that's how I would say that. Yep. And then lastly, like, Michelle and I always emphasize this a lot too, is just, we can't emphasize enough how healthy doctors just equal healthy patients. Like that's the end of the story. If we're burned out, if we're exhausted, if, our empathy goes down, our medical decision-making is poor, all that stuff just leads to bad outcomes for patients. So we have to take care of ourselves.
Yeah, there's a lot in there. And what I really like is we all know that theory and knowledge is great, but the application is what really matters, right? That's what you're talking about here. And, I keep referencing these surveys, and really anybody can Google. And time again, when you ask people what the barriers are of why they're not, quote unquote, eating healthy, whatever that means, right? We would even have to define that. And rarely is it that they don't know that vegetables are good for you, right? I mean, I shouldn't say everybody. I mean, some people truly don't know that. We'd be surprised to find out, but most people know that, no, right? And so just giving that generic advice, hey, you got to eat healthy, lose weight, right? That's not helpful, right? The devil's in the details, kind of what you touched on, and one of the things, of course, is, as you mentioned time and time again, and so I want to ask you now is, if you could define, Michelle, what the term social determinants of health even means, right? This is important. There might be a lot of people in the healthcare industry, and certainly those who don't know what that means. And it's important now. We talked a little bit about the business of medicine. This is one of the key criteria for reimbursement. And so if medical schools aren't teaching it, it's only a matter of time. That's going to be in the curriculum. So, we talked about how socioeconomic status is a strong predictor for health. You've touched on that, and you've touched on that at the systemic level. And that's important. And so if you could define what that means, and I'm also curious at the individual level, right? How are you having those discussions about quote unquote eating healthy and implementing that change that Danielle was talking about?
Great. So I guess like fundamentally with social determinants of health, like at its core, it's really all of the things where we live, where we work, where we play, where we eat that influence our health outside of our individual health behaviors and outside of our genetics. And so, examples of that are our socioeconomic status, food access or food security, safe housing, employment, education, all of these different aspects of our environments and of our society that have an influence on our health and our health outcomes. And so, when I think about the social determinants of health, I feel like, we should be evaluating those aspects of our patients' lives in addition to their past medical history, in addition to their social history. We really need to be screening for these things. And so, but also if you're going to screen for them, we would need to there needs to be systems in place within your practice to respond to them if there is a positive screen. And so an example of that would be screening for food insecurity. And so we teach medical students in our elective how to use a validated tool called the Hunger Vital Sign, which was developed by the American Academy of Pediatrics to screen for food insecurity. It's a two-step question that you can embed into your EMR and ask as part of your intake or as part of a well child visit. And if that screen comes back positive, then there needs to be systems in place within your clinic to connect that individual, that patient, with the resources in the community. We know from other universal screening, like universal screening for depression, that we can do more harm than good if we screen without having responses in place for that. So in addition to, discussing lifestyle changes and lifestyle medicine with patients, we can talk about, nutrition and food as an example. In addition to asking questions about what their general dietary intake, what are the foods they actually are eating, I think to be more, to come from a place of awareness and from the lens of social determinants of health, we need to ask questions about whether that individual has, the resources within their home to actually cook that food. So, if we're going to ask someone to make changes and incorporate more whole foods into their diet, that requires more prep, for example, or more actual home cooking in a kitchen. We need to be asking, do you have, a functioning stove? Do you have, do you have a knife and a cutting board to be able to cook, to prep those vegetables? And I think, those types of practical questions are so important. Another example would be for physical activity and movement. Not only do we need to ask about, how many minutes of activity are they getting a week, but, and what types of activity, but do they have a safe place in which they can do that? Do they have access to a park nearby? Can they afford a gym? Do they have equipment at home that they could use? And that is coming from a lens of the social determinants of health as we look at lifestyle medicine.
Yeah, it's not. I'm not sure what mnemonic you guys learned, but it's not part of the OPPQRST that I learned, right? Or old charts or whatever it is, part of the history taking process. And so, you're talking about teaching the next generation, right? And putting this in their repertoire of history taking. So, I'd love for now kind of us to talk about the electives that you guys are teaching. And you brought up food as medicine and that concept. And depending on what side of the spectrum you're on, it can be a very charged topic. And so talk a little bit about the medical school curricula, the electives, and how that's going.
So we started food as medicine, and it's actually a completely virtual elective. It's has podcasts and some videos and articles, like research articles, and then there's a few projects that the students do through it. And our main goal was really to kind of fill that gap of nutrition. and exercise knowledge, and give them at least a foundation for which to kind of build on. And also, we like to use those 4 weeks because in medical school, there's very little time spent on your own health. So we encourage some healthy behaviors and discussion about what it means to have those healthy behaviors. So, there's mindfulness exercises in there, body scans, getting enough water, limiting your caffeine, talk about exercise with them. So it's really them kind of going through the motions of making these lifestyle changes as well. And we've gotten really good feedback about that because I don't think in med school you really have much time to kind of take a breather and think about, okay, am I healthy? Is this, are the choices I'm making good for my health? So I think that has been one of the big pluses of the curriculum. And then Michelle mentioned part of that is we have them do those social determinants of health, and it's amazing how, unless you think to ask those questions and think about wellness from a lens of the social determinants of health, because you kind of think about a lot of people take a gym membership for granted, take a safe place to walk for granted, access to food for granted, right? Like those are just like things that we assume that most people have. And your patient population will continuously surprise you on that. People you think are, it's kind of like everybody's leading a hard battle, right? Like you never know the inner workings of your colleagues or, your patients. It's always people put on a good face and they will kind of rise to your expectations. So if you just assume all these things are going well, nobody wants to tell you, they're barely hanging on, kind of like the depression screen, right? Most people are like, we're good, everything's good, we're fine. So it's really important to kind of look at that through that lens. And then one of the fun things that we do is we have this whole, one of our registered dietitians talks a lot about like food myths, because I think we all come in with this $1 billion marketing campaign behind us, right? Like words like natural, non-GMO, organic, fresh produce versus frozen versus canned, and we have these assumptions about what is good food and what isn't good food. And that can be really alienating for patients, because if you can only afford canned vegetables, then nobody wants to poison their family with GMOs, right? Like that's terrifying. Like nobody wants that, So you kind of just come in with this lens of like what is healthy and what isn't healthy. And if it's wrong, and a lot of times it's wrong, it's a huge detriment to your patients. I think that's the lens of which we come at the food as medicine. Do you have anything to add, Michelle?
Sure. Yeah, I think that pretty well covers it. I guess the other aspect of this, is the food access assignment that the students do as well. So they do look up, they select a county in Georgia, and then they're able to research a food access program within that community. And so they learn about it, and then they create like a flyer that could be used with patients as a patient education tool. But it's not so much the flyer that really has a lasting impact on the students. It's them going through the process. Many of them call the organizations themselves, going through the referral process as a client would, and they realize how limited resources are, and how they vary across the state, and the barriers that people face to access community resources.
Yeah, it's so awesome to hear, because I think the average stat, I think in a medical school, you get about 23 hours in the entire, first 2 years to kind of learn about like food, right? Nutrition, wellness. Even going to an osteopathic medical school, right? I mean, I think I may have gotten 6 to 10 hours on quote unquote holistic medicine, minus just the OMM portion. So it is really funny how I think a lot of medicine is transitioning towards more the allopathic side, right? And we've kind of lost those osteopathic roots, or even just understand the naturopathic, if I could use that word. So it's really cool to see you guys bringing back this food is medicine concept, right, to teaching it to students. Now, are they in their preclinical years? Are they third or fourth year students?
They're fourth year students.
Fourth year students. Okay. And then
Yep.
what are kind of the next steps that you tell them to look at? So they're thinking about intern year, they're probably applying. Are there any kind of next steps that you guide them to? Is it like ACLM or other types of programs?
We usually do guide them towards, so residency is kind of like, everybody remembers fourth year, right? It's like you have tunnel vision. You are just like residency, like that is like your goal. But we do tell them other resources that are out there. We make ourselves available. And hopefully it's just this like pearl, right? This like little, whisper in your ear that's there at the end of, 'cause, residencies just sucks, it's just like so hard and
Yeah.
you're so tired and you barely have time to like do anything else besides just residency. So I think, if you would have asked, I was learning Tylenol doses, so I don't know how much lifestyle medicine education I was, effectively giving, but I think that maybe if I had known more, it probably would have become more natural too. So I think our goal is just to have them, one, take care of themselves, and then two is to have some kind of basis from which to speak to, hypertension, diabetes, and just know, and also know what they don't know.
Yeah.
And because I think, I really think that is so dangerous in medicine. I can't tell you how many doctors just tell patients just like these crazy things that it's like, where did you learn that? And we treat everything like a hard science except nutrition. And it's somehow that's just like, whatever, glamour magazine prints or you read online is like good to go. So hopefully we've given them a good basis to know where to find good resources and ask good questions, and then also to ask their dietitians and kind of treat that more as a communal goal and exercise.
Yeah, I love that. It's kind of like a three-pronged approach in the way I see it, right? One, you're trying to make the individual healthy themselves. Two, knowing what the facts are, right, in order to teach. And then three, knowing what to ask in order to implement those changes, right? And we kind of do that in rehab too, right? If somebody has a stroke, a lot of times we have to say, okay, you can't just go do physical therapy. It's, well, how many stories do you live in, right? Do you have handrails? So asking those questions because they're truly important, right? So super cool stuff. I want to transition into the other elective that you guys also teach, and I think this is going to be fascinating to learn about because there's this huge movement now, I think, with pre-med students, social media, the advent of social media, which has caused a lot of people to try to do side hustles and learn how to get into tech and, medicine as a whole, just, outside of it just being siloed like you were talking about. So take us through this entrepreneurship innovation course that you guys teach.
Yeah, sure. So this is a new elective that we've developed over the past, 6 months, and it was actually student driven. So as you mentioned, like the up and coming students and learners are just yearning for this kind of information. And we actually had a third year medical student with us in this past December on site when we were hosting a live stream lifestyle medicine conference at a studio in Brunswick where Danielle lives, and I'll probably have her chime in after I'm done here to share more about that experience. But the student was on site in the studio while we were, live streaming this conference. So we had a kitchen set up with a chef, whom is Danielle's husband, as well as a dietitian, doing culinary medicine demo videos, and she was just in awe. She's like, you are doctors and you are producing content like this and producing conferences like in a studio. This is amazing. And this is the kind of stuff that like we need to be learning about as, physicians that are, especially those interested in entrepreneurship and innovation. So it was really the feedback from the students that helped us develop the course. And so similarly to the Food is Medicine course, we produce all of our own content. So we have a series of podcasts where we've invited on various experts. We have physicians whom I would consider innovators and disruptors in industry, people that are, out there at the frontiers, pushing the envelopes, doing startups. We have a nurse duo who have created safe seizure pads, and they walked us through the entire process from prototyping to patenting to their first sale and what that has looked like, which was really exciting. But then we also bring in, so in addition to the disruptors and innovators, we also have a week focused on medical writing and publishing. So for those of us who are interested in being, medical correspondents with news, or want to be contributors to, different press on health topics, how can you get involved in those types of activities? What's it like to work with a publisher? Things like that. And so that's just a little bit of it. And I think I'm going to throw it over to Danielle and let her expand, because she's really been the brainchild for this one.
So I think, picking back off of Michelle, I think as physicians, we've lost our voice. We don't talk about issues that we are experts on. We have kind of given that over to pundits, over to administrators, over to politicians, right? They're all making these big decisions that impact us, that we have to deal with the ramifications of, and we don't have a voice, and nobody listens. And I think that, that's one reason that Michelle and I, developed Rethink Health, is we want a voice. We want physicians to have a voice again. We think that, the course of medicine will be better if we have a platform, if we speak up, if we collaborate, and it's scary to be a disruptor. It's scary to be an entrepreneur. There's no handbook for us. There's tech. There's so many other. There's so many handbooks for other industries, right? It's like, as a physician, you're supposed to go to medical school, you're supposed to go to residency, and you're supposed to become an attending, and that's it, right? And there's some of us who are doing crazy cool things and thinking outside of that traditional box and moving past that. But we're not talking about it. We're not telling other people. So that was kind of, and we had two medical students when one presented at the conference, because, one of the things that Michelle and I do is we love medical students. They are just so passionate, and so they're out of the box thinkers, and they want a different world. They're not satisfied with the status quo, and they are going to be the real movers and shakers of medicine. They inspire us on a daily basis. So, having those two medical students there while we were live streaming a conference, we had a studio, and physical therapists were doing movement demos, and we had some. She teaches like the pathophysiology of yoga, right? So all the scientific stuff about what your brain does on yoga, and then she led everybody through like mindfulness and breath work, and to see how excited the medical students were about that, and just their, the idea that medicine is more than just your clinic, and it has like this huge potential, and we have this huge potential. So that was like the genesis of that innovation and entrepreneurship, and we have spoken to, people who do graphic medicine. I didn't even know that was a thing until recently. Some really, New York Times selling authors. Like, it's been just so awesome, the responses that we have received, just randomly sending them a DM on Instagram or an email. And everybody is so excited to share their story and to talk to other people. And I think that was probably the most surprising thing, is how easy it is to get physicians and other healthcare professionals, because we've talked to nurses, and just to tell their story and say, hey, this is how you do this. I think in the tech industry, we're so used to people being so like, oh, this is a secret and you can't know this, and what's this? You might steal my idea, but that is not us at this moment in time. We are just so excited about telling everybody how to do things better, because I think we're all just tired. and I think COVID kind of pushed us all to this breaking point, which I think we needed that kick, right? I think it's a good thing, and I think it'll be a good thing in the long run. Um, but that's the genesis of it, and it's been such a joy to talk to so many doctors and so many healthcare professionals about the ways that they are just expanding and thinking about medicine so differently.
As I hear you both kind of explain the concept behind these, I can't help but be giddy about the opportunities that these students have. And I find myself kind of wishing that I was going back to medical school and had these opportunities, but then I have to remind myself, no, I'm in a good place. I'm done. I don't need to do it all over again. But I find that interesting, right? So the challenge is, we brought up the fact at the outset of this conversation about how the system's really not designed to be able to practice the way that most physicians want. That we know the drivers for change, but we just don't have the time. This is not set up for it. You guys are obviously doing a lot of great things. And so everything that we have to do has got to be outside your clinic hours, right? You're just tagging on more. I mean, we're here, all of us are serving a purpose here, but we're doing it on late night on the East Coast time at least. And so much of what you guys do is outside of your normal doctor stuff, right? And in order to redefine or rethink, if you will, of how we are going to practice medicine, it does take some time. And so in that time, we have to learn these skills to be able to market on social media, to be able to do the entrepreneurship thing, the advocacy thing that you're talking about. And so I love the two-pronged approach that you guys talked about, right? So at the granular level, just rethinking some of those biases that people are coming in with, hey, GMOs are going to kill you, or these food preservatives are going to kill you. Like, let's just pause. Maybe not so much, right? But so much of the messaging around what we put in our bodies and different foods today, especially with social media, is based on these fear-based approach. And so just getting people to really take a step back and say, hey, listen, this isn't the end all be all, and there's a bigger picture that you got to look at. I think that's strong. And then also being able to give them the voice, Danielle, as you said, to be able to communicate that message clearly, because that's really what it's all about, right? I mean, this is something that Darsh and I talk about offline all the time, and how can we communicate the message more clearly, right? More succinct and make it better. And so on that note, I want to hear a little bit more about Rethink Health. We brought it up a couple of times. You guys have touched on different pieces of it. And so, Michelle, if you wouldn't mind explaining really what was the genesis of this and what it means and how can people get involved?
Absolutely. Yes, thank you for the opportunity. So as we've mentioned, we have developed 2 electives at the Medical College of Georgia. And in that process, we have created a virtual learning platform that houses that content. And so, in addition to medical school electives, Danielle and I talked about how, there's this need for connection and collaboration and community within healthcare. And why not, take this platform and offer it, to a broader audience outside of medical students. And so we have, as I mentioned, this virtual learning platform where we're really looking to create kind of a co-learning community for healthcare professionals where they can come on. It's not on social media. It's its own platform. It has an app where you can engage with content. You can listen to lifestyle medicine based podcasts. You can watch culinary medicine demo videos. You can listen to guided meditations. There is, like a discussion board forum section where you can engage with other healthcare professionals whom are community members to share those resources, to collaborate on your next project, to practice your next elevator pitch for the idea you're looking at. And also in the process, as part of the paid membership, you have the option to opt in to earn CME credit through reflections that you would create in response to the content. And so we're looking to launch our membership for Rethink Health in October of this year. So we're very excited. It's coming up quickly. And, we would love for your listeners to connect with us there. We're looking, to build a really robust community where, we can just continue to make changes in our own lives and in our communities. And so I think that's kind of an overview. I'll kick it back to Danielle to have her add on as well.
Yeah, I would say that learning is fun. And from what I remember, being a kid and watching National Geographic or Discovery Channel is that, I could learn all about the digestive process in sharks, right? And they would just present it in this way that I could watch an entire hour on that, right? And I think that somehow in medicine, we've lost that. Learning is no, yeah, I'm nerdy. It's okay. But we've lost that in medicine, right? It's like this chore all of a sudden. And to do CMEs is kind of like this really boring thing you have to do, and you just do it to check a box. And it's like, no, that's not how we're wired. That's not who we are. So I think, Rethink Health is definitely a co-learning community, but it's supposed to be a lot of fun, like medicine should be fun. Learning this stuff should be fun. And I think that we learn differently than probably our predecessors. We like podcasts, we like different media apps and different, different ways of learning than they did. And medicine's not so much in academia, right, anymore. I think that's true of like everything, that, we can teach each other things. I learned so much from Michelle that I couldn't find in a textbook. I couldn't find anywhere else, just because she had done it. And, the barrier for entry for us to do things is so high, right? You've got to figure out what a patent is. You have to figure out what is an LLC, what is an S corp, all these other things. And so if we can just like lower that barrier of entry for physicians, for healthcare professionals, if we can just make it easier to create things, that's the idea, is just to make it easier, is to give you resources to figure out how to do this stuff on your own, and then to connect you to people who've done it before, to ask questions, and we talk to attorneys for you, and we had an interview with just to kick it back to the INE elective, we walked through the entire process for creating a business and what the tax ramifications are. I mean, some of that stuff is boring, but if you want to actually do this stuff, you got to do that stuff, So it's just about creating this community where physicians have a real world impact. And it's, it is about late nights and stuff, but if you can take off a couple of those notches, then it makes it a little bit easier for people to do those things, right? And for all of us to have a bigger platform and a louder voice.
Well, Danielle, what I will say is that I can certainly agree with the statement that you made, that learning is fun. Granted, it's got to be something that, we enjoy learning. And I think much of what we talked about today definitely fits in that bucket for me. And I'm glad you brought up CME. In preparation for this, I came across something called the Clean Your Plate CME Adventure. And so, Danielle, would you care to talk a little bit about who that's for and when that is? Because I believe it's coming up this fall. And, what can attendees expect to get out of it if they choose to attend? And they should.
Yes. So actually, we are going to push that back. So COVID struck again in California. Oh, no. Yep. So it's actually going to be in 2023. We're still working on the date. We'll have it by the end of this month. But so learning should be fun, and that's kind of how we approach our conferences. What does it mean to not just sit there and learn how to do breath work, but what does it mean to engage in that? There's, really good research on nature therapy and how it's great for anxiety, depression, blood pressure. So what does that look like to go on a nature walk and learn why you're doing it, and have a lecture there? And, one of the things that's been really cool is this would be our fourth conference, and that everybody who's come has brought like 2 or 3 friends. And it's just this people go out to lunch together. Like, I've never been to a CME where people actually like connect and hang out and become friends. And it's the idea that learning is fun, and it should be fun, and we should enjoy it, and we should like going to CMEs. And, I've always been to ones where you just you check in, you listen, and then you leave. And the goal of this is not that. And then the other part of that is, we offer scholarships, because, not every physician makes a ton of money. And I don't, we believe that, education and wellness is for everyone, regardless of financial resources. And then the third part of that is we also have fundraising dinners for certain physicians that are local to the conference in San Diego. So, doing community work is hard. getting a vegetable prescription program off the ground is hard. Wouldn't it be cool if we supported each other in those endeavors? Wouldn't it change the game? So it's just this idea that learning's fun, we can support one another, and get CME credit on in the meantime.
I love the vegetable prescription. I think about there's a physician on the Ready State podcast a long time ago. I heard Dr. Nick Denubly. He's an orthopedic surgeon in the Philadelphia area, and I remember him telling one of the physical therapists he was talking to, Kelly Starrett, previous guest, that he often will, on a prescription pad, right, just like, follow a mobility WOD or do move more. And I love the concept of writing a prescription pad, eat 5 servings of vegetables 3 times a day, or that's a little too much maybe, but 5 times of vegetables daily for 5 days or something like that, or start there. And maybe it's something I'll start doing in my practice as a start. But on that note, I do want to, we brought up this concept of food as medicine a couple of times, right? I think it's the basis of a lot of what we talked about. It's important because it's so intertwined in our lives, every second. We talk about how these pillars of health span that we always discuss, exercise and exogenous molecules and sleep and that kind of stuff. And you can pull on some a little bit harder, and they've shown to be more beneficial when it comes to health span. But food is the one that's every second. And so it can be the most challenging for people. And this concept of food as medicine can be very beneficial. We know that. We all know that. And patients know that. Some of them at least. But I think it can also be harmful, right? I think we've all had the patient, and I've had family members who think that they don't need to take their medications for hypertension because they can take a beetroot juice and eat beets. And those are certainly good. And they have medicinal properties, they have therapeutic properties. We know that. Same thing with not taking their diabetes medication because they can do apple cider vinegar and something like that. So these are just examples, and I'm sure you guys share that. And I've heard of people, physicians, and with good intention, talk about how that can be a toxic and harmful message. Now, of course, nuance is everything, and we often say on this podcast that context over content. But I'd love to get your take on just that aspect of how that can be harmful and that could potentially backfire, and maybe if you could give some specific examples and how you can make that a little bit more clear for patients.
Sure, yeah. And I do agree. And I have seen, others in healthcare and outside of healthcare, have this discussion about, what could the unintended effects of the food as medicine message be with individual patients, as well as just with, the general population. And I agree that I think context really does matter, and that when I'm working with patients, I really try to emphasize it's not an either or, it's a yes and situation. And so I think that is where we really need to make that clear with the message, in that, food is medicine, as well as the medications that people need for their chronic conditions as well. It does not have to be an either or situation. And I think that why I feel strongly that the food as medicine message is needed is that for so long within healthcare, there has been, such little emphasis on nutrition and the importance of food in our diet, or food and how it impacts our health, as evidenced by the fact that physicians only get about 23 hours of nutrition education over the course of our medical education. And I think that, as physicians and with the healthcare community, we really need to, emphasize that, nutrition and, healthy whole foods really are the foundation to a healthy life. And, but that does not mean that it's going to replace the modern medications that we have and need in individual circumstances. And so I'll kick it over to Danielle as well.
Yeah, just real quick though, I know we brought up that number, and I think what's important to note about that statistic that Darth brought up is that most of the nutrition education is really getting at the biochemistry level, right? Or the pharmacokinetics of food and stuff. And what we're not learning about are, strategies like motivational interviewing and talking about the behavior in the day-to-day, and much of the application that Danielle talked about a long time ago. So that's also an important thing. And that's this is one of the reasons why I was getting so excited about the electives that you guys are offering.
Yeah, and I think, like you said, like there's nuance to all this, right? Like to say that food is not medicine is to ignore a plethora of research. I mean, the DASH diet is equal to a blood pressure medicine, if followed correctly. Like that sounds like, pretty medicinal. And I think where we get lost is when we separate the micronutrients, right? So beetroot juice, or we get into the weeds with the stuff that's like a little, maybe not so scientific, but really trendy. So I think that is where, food as medicine can be misleading. And it's also, it's not a hashtag, like it is, but it's not in the day-to-day practice. So, I think we have too long ignored how important exercise is, how important your diet is, how important stress reduction is, how important good sleep is, and if we continue to ignore it, it's at our own detriment. It's at the detriment of our patients, right? It's at the taxpayer dollar, right? Like you could kind of go on down that road. Michelle and I always talk about this because there's always people who get really upset about the food as medicine. I don't want to say tagline, but that phrase. And, you kind of always have to check yourself and like, what does that mean? Because you don't want to do harm, right? You don't want to harm your patients. You don't want to harm yourself. But I think if we think of food as not medicine, that's a more dangerous road to kind of go down.
Yeah, I think it's nuance in the end, right? Just like you said. So I love how you asked the opposite, right? You put that not in there. So Altamash and I just did a recent episode called Progress Note, right? It's our new project that we're kind of taking on polarizing topics and trying to break down the science and the gray area, right? And so our first one was about meat and cancer. And so you can say meat causes cancer. Well, no, not really. But then if you ask the opposite, meat does not cause cancer. No, not really, right? So there's obviously this kind of gray area where you have to talk about, well, if you add this and this, then this is the outcome, or if you take away this is another outcome, right? And I think it's tough in the world we live in, right, with social media. And so I think, like you said, as much as we can give the context and constantly ask questions, not only just give answers, we're going to get to a better place where we can at least safely educate the people who really need it, right? I think for us, we understand it, we get it, but we are now in those roles of being the teacher and really try to provide good education to the masses. So I appreciate both your perspectives on that. I did want to ask a question kind of going back to entrepreneurship, and just because you guys are very much a dynamic duo, right? I think you guys complement each other very well. And it was interesting, just last week, I was listening to a podcast episode on the Knowledge Project, and it was a serial entrepreneur, Andrew Wilkinson. And he talks about finding the right CEO or the right business partner, right? And he asks these two questions whenever he has to come to that. And he says the first one is, can this person babysit my child? And then the second question is, if I was stuck in a cabin on a cruise ship for 3 days with this person, like, would I survive? Would I be okay talking to this person, right? And I think those are pretty comical, but also kind of true, right? I think about Altamash. I'm like, yeah, I think you do a good job taking care of my kid. And then if I was stuck on a cruise ship, I mean, I think we'd probably just work out, for 3 days straight or something. But but thinking about how you guys collaborated, you guys meeting through social media. I know you guys were talking about learning from one another. What are those things that pre-med students, let's say, should start thinking about, right? As they think about entrepreneurship, creating ideas, collaborating with other folks. What are those things, those pearls that you want to give them that they should really be thinking about?
So I would say is find somebody who you think is smarter than you in some way. And sometimes that's like a really hard thing to do, right? Because we're all a little insecure.
Yeah.
But Michelle is she is brilliant. She amazes me every day. She thinks of things in such a scientific and logical way that just I'm much more of a dreamer. I'm like, oh, we should do this, and wouldn't this be amazing? And she is in the details. And I don't find that intimidating. I find it amazing. So I think that if you find somebody who you think is smarter than you, and not to be intimidated by it, because I think I've listened to other not successful entrepreneurs talk about it, and they kind of self-sabotage themselves because they work with people and they just become intimidated and then they fire them or they leave, right? And it's because they want the spotlight or they want the limelight or they want the credit. And you have to be willing to give up that credit, right? You just, it's more about the vision and what you're creating and how that person can make it better. And, and just eat some humble pie every day.
Yeah. How about you, Michelle?
This question always makes me giggle a little bit because I think about conversations Danielle and I have had, and I feel the same way about her and her vision. And it reminds me of in our residency program, we had 2 co-chiefs, and the most successful co-chiefs complemented one another. And so when I was going through, I was the details chief, and then we had the big picture idea chief alongside me. And I feel like that's who I've found in Danielle. She's a beautiful dreamer and has a big vision and a big heart for this, and she amazes me at the innovation that she brings to the work that we do, to the connections that she makes with the people inside medicine and outside. And so I really think that, it is important to have, diversity in your team, diversity of thought, diversity of backgrounds, experience, but also to complement one another. Because as we've said, we are not experts in everything. And it's really exciting to see the synergy that you find in a team like that. It's really rewarding and inspiring.
Yeah, no, that's awesome to hear, amazing to hear, and I think it is very evident, as we talked about for the last hour, everything that you guys are doing, collaborating with, and just both of your thought processes are very, very interesting and awesome just to hear and kind of bounce ideas off of. So, what is next for you both? What is next for Rethink Health? Where's this all going in your minds?
Take over the world, obviously. So launches, I don't know. We've had a lot of people say no. I just can't wait till we don't even have to ask them anymore. So that's exciting to think about. So we launched in October. I think the future of Rethink Health is you guys, all our fellow physicians, the excitement of creating something for them, with them, by them, and just the idea that we can, we don't have to ask permission. And I think that's like because creating a nonprofit, going back to that, you always have to ask people to donate, to support this, to do that. And it's like, what if we didn't have to ask that? What if we didn't have to have administration say like, oh, this sounds good? What if we were free from that as physicians? What if we had a bigger platform? What if we had a collective voice? What if we put the patients and ourselves back into that synergistic relationship? What would that look like? There's so many cool things that we have talked about and dreamed about. But I think that this platform and this community is the first step. And the idea too that we want to learn from other physicians, and we want their voices to matter and their ideas to be circulated. Like Rethink Health it starts with Michelle and I, but it continues on the backs of other healthcare professionals and their dreams and what they want to do, and how they see the world and how they want to impact it. So I think that that's how we see the future, is that this is very much a community project. And if there's documentaries that people want to create, if there's visual art, graphic medicine, books, whatever it is, we want to be able to lift that up and to give healthcare professionals the ability to create those things and get a little CME.
How about you, Michelle? Where's this heading for you? What are you agreeing? Take over the world.
Yeah. Yeah, I agree with Danielle. I think that it's really exciting to be at this point where we're ready to get it out into the world. So, you can find us. Our website is rethinkhealth.group. We do have a wait list there for our membership. So if anyone is listening and wants to check out, our community, you can join the wait list. As we mentioned, membership will open in October. Yep.
Awesome. Yeah, and we'll be making sure to put all your socials, the websites, and everything into our show notes. So for those listening, there's going to be a good amount. So just easy access. Go to our show notes, and you'll be able to find it there. Last question, Michelle. We'll start with you. This is going to be a really interesting question, just because I feel like we've really talked about this for the entire episode. So love to see kind of what you pinpoint here. But how do we add the health back in healthcare?
That's such a great question. And I guess I'm going to take it from, the lens and where I'm at in my career right now. And I feel like we need to bring community into healthcare. And so whether it be community of our colleagues, but also the communities that we live in and how we can better connect them to our current healthcare infrastructure. So that's my answer.
Love it. How about you, Danielle? How do we add the health back in healthcare?
Yeah, so I think that it really starts with just thinking outside the box for medicine. What does that mean in everyone's community? What does, vegetable prescription programs, unconventional CME, what does that mean for reaching out across, social media platforms and connecting with others? Just thinking about medicine in a different way, in that non-traditional kind of lens, and viewing it as a world of possibilities.
Yeah, fantastic. Wow. I want to thank you both so much for taking the time out, sharing your perspectives, your thoughts, everything that you guys are doing. Again, you guys are really a dynamic duo, and I'm super excited to see, where it all ends up, kind of seeing your progression and following along on your journey. So thank you guys both again so much.
Thank you. It's been awesome to talk to you.
Yes, thank you so much for the opportunity.
Absolutely.
This was a great
Thanks.
discussion.
Thank you for tuning into another episode of Medicine Redefined. We love creating this show and hope that you guys find it as valuable as we do while we're researching or having discussions with many of our guests. If you do or you don't, or if you have any tips for us to make this a little bit better, just to make it a slightly better experience for you or really anybody that you've shared it with, please shoot us a message. You can reach us at all the usual suspects on social media. MedRedefined is our handle, but you can also email us at medredefined@gmail.com. We'd love to hear from you. Now, I think that's all we have for today, but I do want to remind you that everything in this podcast is for educational purposes only. It does not constitute the practice of medicine, nor should it be construed as medical advice. No physician-patient relationship is formed, and anything discussed in this podcast does not represent the views of our employers. We recommend that you seek the guidance of your personal physician regarding any specific health-related issues. But, as always, if you enjoyed the show, please be sure to subscribe, review, share with anyone who you think will gain value, and we hope to see you next time. Thank you for listening.